السلام عليكم ورحمة الله وبركاته. نرحب بكم طلاب الدكتوراه في الكورس الثاني ونتمنى لكم التوفيق. راح نباشر بمحاضرات الثيرابيوتكس إن شاء الله، وراح نبدأ وياكم بموضوع الريسبيراتوري disorders. أول محاضرة راح تكون الأسمى، راح نبلش بها اليوم إن شاء الله. As you know, asthma can be defined as a chronic inflammatory disorder of the airways which can cause cough, wheezing, chest tightness, and shortness of breath. And these signs or symptoms can worsen at nights. The prevalence of asthma is between 10 to 15% of the population all over the world, occur mainly or start mainly in the second decade of the life, which is more common in the developed countries. Asthma characterized by airflow limitation, but fortunately it can be relieved by treatment, also by airways hyper-responsiveness to a wide range of stimuli. Also, another patient can present with inflammation of the bronchi, in which there is an overactivity of inflammatory cells like eosinophil, T lymphocytes, and mast cell, which associated with a plasma exudation, edema, smooth muscle hypertrophy, overproduction of the mucus, and epithelial damage. But in type of chronic asthma, inflammation may be accompanied by irreversible airways inflammation, which is the challenge. Asthma classified into two major types, extrinsic and intrinsic asthma. Extrinsic, which may be due to external cause. Intrinsic or cryptogenic, there is no specific cause to be identified. Extrinsic asthma occur mainly in atopic individual. What does mean atopic individual? Atopic individual who have positive skin prick reaction to a specific or common inhaler allergies. Different study shows that this patient with positive skin prick test can show a positive skin prick test, and 90% of children and 50% of adults with diagnosed asthma. Some of children with childhood asthma is often accompanied by eczema, and another study says that even if the children have no eczema or another atopic reaction, it may be due to family history with the first degree with these types of allergies. Another type, which is a late onset asthma in adult, is sensitization to chemical or biological products, which occur mainly at workplace. While intrinsic asthma, which is also called as adulthood or late onset asthma, can be triggered by non-allergic factors, different factors like viral infection, irritants, or any another agent can cause epithelial damage and mucosal inflammation, in addition to emotional upsets and exercise. Even so, intrinsic asthma patients may show positive skin tests, and this test can give a history of respiratory symptoms comparable or compatible with childhood asthma. While patients which are non-atopic individual, which is mainly a presence with intrinsic asthma, may develop asthma in middle age or for intrinsic cause like sensitization to different type of agents like aspirin intolerance, or because they are given beta blockers for their hypertension or angina. So that extrinsic cause may be considered in all cases of asthma, and where possible should be avoided. Etiology of asthma. Different factors may cause asthma, as I mentioned before, but we can focus on hyper-responsiveness and bronchoconstriction and other factors that lead to these two factors. Hyper-responsiveness, which is mean increased tendency of the airways to react to stimuli or trigger to cause an asthmatic attack, while the bronchoconstriction mean the narrowing of the airways that cause airflow obstruction. There is a wide range of stimuli that may cause direct or indirect reaction for asthmatic patients: cold air and exercise, a specific type of diets, different type of drugs like non-steroidal anti-inflammatory drugs or beta blockers, and also emotional upsets. Allergen-induced asthma. Allergen may cause immediate reaction or early reaction, or may cause late phase reaction, or maybe both, dual reaction. For immediate reaction, this can occur within minutes of contact with the allergen and reach maximum period of 15 to 20 minutes and subside by 1 hour. While the dual reaction, which also can occur within a few minutes of contact with the allergen, but developed for more prolonged or sustained attacks of the airway limitation. These types of reaction may be less response to inhalation of bronchodilator drug such as salbutamol. Some of patients present with isolated late phase reaction means there is no preceding immediate response can occur after inhalation of some occupational sensitizers like isocyanates. And another patient may present with recurrent asthmatic reaction in which the development of late phase reaction is associated with increased the underlying level of airways hyperresponsiveness. This means that the patients already have hyperresponsiveness but may be increased in a specific period of times. You show this table presents with different type of trigger factors and their examples like allergens. Allergens include pollens, molds, house dust mites, and different type of house animals. Industrial chemicals, mainly isocyanates containing paint, epoxy, resin, aluminum, hairspray, and so on. Drugs, mainly aspirin, morphine, and other non-steroidal anti-inflammatories. Prostaglandins, synthase inhibitor, and also beta blockers. Specific type of food can also trigger the asthma, including the nuts, fish, seafoods, dietary products, coloring reagents for the food, especially tetrazine, benzoic acid, and sodium metabisulfites. Environmental pollutants like traffic fumes, cigarettes, and sulfur dioxides, and other industrial triggers like wood, grain dust, colophony in soldiers, cotton, and so on, and other miscellaneous trigger factors like cold air, exercise, hyperventilation, viral respiratory tract infection, emotional upsets, or swimming pool chlorine. When we discuss the pathogenesis of asthma, we can see there is a complex matrix of pathogenesis that may lead to asthma, but mainly the varying clinical variety and chronicity of asthma depends on the interplay between the airway inflammation and airway wall remodeling. Starting with inflammation. Inflammation can occur due to cell infiltration caused by subbasement fibrosis, overproduction of mucus, epithelial injury, smooth muscle hypertrophy, and angiogenesis. This process, inflammatory process, is driven by Th2 type T lymphocyte, which facilitates IgE synthesis through production of interleukin 4. That's why there is a drug for asthma can act to block this type of interleukins, and maybe due to eosinophilic inflammation through activation of interleukin 5. Remodeling of airways may occur. What does mean? There is an alteration of structure and functions of the formed elements of the airways. As you see in this figure, the differences between the normal or asthmatic bronchi. In asthmatic bronchi, there is a narrowing airways, there is a tightening muscle constriction of the airways, there is a thickening airway wall due to inflammation and overproduction of mucus. Now, what are the clinical features of asthma? All of you know there is a wheezing attack, dyspnea, which may occur at day or during the night. Mostly it's worsening during the night. Cough may be frequent in some patients and also occur at night, nocturnal cough. You have to know there is a variation of the frequency and the duration of the attack. Some patients can have only 1 or 2 attacks per year, which may last just for few hours, while other, which is chronic asthmatic patients, the attack lasting for weeks. The important things is the impaired quality of life. This is very important. This can interfere with the work of the patient, with the recreational status, as well as physical activities and emotions. Now, how we can investigate patients with asthma? There are different types of investigation or tests. The important one is the respiratory function test, including different type of tests. First one is the peak expiratory flow, which can be measured on waking or before bedtime after inhalation of bronchodilator. Another test is the forced expiratory volume, which is also useful to show the abnormalities in the airway functions. FEV1, which is measure the FEV within the first second of exhalation. Asthma can be diagnosed by demonstrating a greater than 15% improvement in FEV1 after inhalation of bronchodilator. Another test is the forced vital capacity, which is the assessment of the maximum volume of air exhaled with maximum effort after maximum inspiration. By this way, we can measure the ratio FEV1 over FVC ratio. Also, it's useful and highly reproducible measures to measure the capabilities of the lungs function. Normally, patient will normal individual can have at least 0.7 or 70% of their total capacity in the first second, while patient with asthma or with obstructive lung disorders, the FEV1 is usually decreased, severe decreased, while FVC normal or slightly reduced. This leads to the ratio less than 0.7. There is a variation between day and night, diurnal variation of PEF, which is also considered as a good measure for the asthma activity. The diurnal variability, if there is more than 20%, is highly suggestive of asthma. Okay? While to assess a possible occupational asthmatic or occupational type of asthma, peak flow need to be measured for at least 2 weeks at work and 2 weeks off works, and then compare the results between two measures. All these tests can be measured by spirometry, while usually carbon monoxide transfer test may be normal in asthmatic patients. This figure shows different type of or different stage of severity with asthma. Measure the FEV1, FVC, and the ratio. As you show, there is a normal, mild obstruction, severe obstruction, and restriction case. In severe obstruction, as I mentioned before, FVC may be normal or even so slightly decreased, while FEV1 and the ratio and the PEF, all of them are decreased. Another test is the exercise test, mainly used to diagnose the asthma in children, which is also a challenge with hypertonic solution. Even so, the negative test does not automatically rule out asthma. Another type of test, the blood and sputum tests, in which we can investigate the number of eosinophils, which is increased in most type of asthma. The presence of large number of eosinophil in the sputum is more useful diagnostic tool. Chest X-ray also is important. Important for what? For excluding another respiratory disorders, mainly pneumothorax, which can occur as a complication of asthma already, or to detection of pulmonary shadow associated with allergic bronchopulmonary aspergillosis. Skin tests. Skin prick tests should be performed in all cases of asthma to help to identify the allergic cause. Allergen provocation tests, which is the allergen challenge, is used in case of suspected occupational asthma, and in some types of asthma we can diagnose the type of food that cause allergy.